My name is Corey Arakaki, and I serve as a facilitator for our Connection Recovery support groups here in Nami Hall County. Today, I'm going to talk about the impact of sleep on mood disorders such as major depressive disorder, bipolar disorder, or psychotic disorders such as schizoaffective disorder and schizophrenia. Now, when it comes to major depression and the lack of sleep or insomnia, that's actually going to exacerbate your symptoms of depression. In the case of bipolar disorder, lack of sleep is often a precipitator to a manic episode. And finally, when it comes to the schizoaffective disorders or schizophrenia, lack of sleep is actually going to exacerbate the positive symptoms of the illness. So, positive symptoms in the context of schizophrenia includes hallucinations and delusions. To use myself as an example, my first manic episode took place when I was 16 years old, and I was getting 3 hours of sleep each night for a period of 3 months. After my hospitalization, all of my psychiatrists since then have been very protective of my sleep. And as a result, I take three separate medications each night to ensure that I get the proper amount of sleep. And the general consensus in the medical community is the right amount of sleep is between 7 or 8 hours of good, uninterrupted sleep. There are many therapeutic benefits when it comes to getting good sleep. One of the neurochemicals implicated in sleepiness is a chemical called adenosine. And adenosine builds up in your brain throughout the day. And as it gets closer and closer to nighttime, that buildup of adenosine is what makes you feel sleepy. Now, if you get poor sleep and you get only, say, 3 or 4 hours of sleep at night, your body does not have the opportunity to clear all of the adenosine out of your system. And as a result, when you wake up after maybe 3 or 4 hours of sleep, that's why you still feel groggy because your body has not had the ability to clear the adenosine from your brain. Getting a good night's sleep is directly correlated to memory retrieval and concentration. That's why it's never a good idea to stay up all night and study for a test and take the exam in the morning. Because, as we said, for one thing, the adenosine that builds up in your brain is not going to be cleared out because you didn't get enough sleep from the night prior. And also, when you need to recall important facts or formulas to do an exam, that memory retrieval is not going to be as precise as it should be. And as a result, everything in terms of concentration, memory, sleepiness, grogginess, you're going to have all four of those things working against you. And it's because you stayed up all night trying to cram when in fact what you should have been doing is getting a good night's sleep and then taking that exam in the morning while being well rested. As you can see, getting good sleep is critical for both your mental and physical health. However, for those of us with psychiatric conditions, good sleep can serve as a protective barrier against decompensation and hospitalization. So please, above all, do your best to protect your sleep. It'll help you out, it'll improve your concentration, you won't feel groggy, and you'll be able to make the most out of your day.